bleeding or hemorrhage or blood loss is blood escape from the circulatory system from damaged vessels. Bleeding occurs internally or externally, either through a natural opening such as the mouth, the ears, the eyes, the vagina, the urethra, and anus, or through a puncture in the skin. As we already know, the main components of the cardiovascular system are the heart, blood, and the blood vessels. The heart contracts and makes about 80 beats per minute. The heart pumps the blood through blood vessels, and blood transports the oxygen, nutrients, and special substances to the cells of the tissues of the human body. There are a lot of blood vessels in the human body. They can be grouped in three groups. They are the arteries, veins, and capillaries. The arteries are strong muscular blood vessels that carry oxygen-rich blood from the heart to the different tissues of our body. The arterial bleeding is the most severe and this is very severe and dangerous type of bleeding. It comes a result of a penetrating injury, blunt trauma, damage to organs and blood vessels. As it comes from the arteries, it is distinctive from the other types of bleeding. For example, this blood is bright red due to its containing oxygen, and it comes in spots and pulses which correlate to the beats of the heart. And this type of bleeding is hard to control because the pressure of the beating heart means that it will not be easy to stop, and it will not clot as easily. The veins, as compared with arteries, have thinner and less muscular walls. This is because the lower of pressure in the veins is the level of the pressure in the veins is lower than in arteries. The venous bleeding is less severe than the arterial bleeding, but it still be life-threatening, and it requires an immediate medical aid. Because of the blood comes from the veins, it is dark red. This is because it doesn't have as much oxygen. The blood in the veins flows steadily and less forcefully than in arteries because, as we know, veins are not under the direct pressure. The treating of the venous bleeding is involves the same procedures as the treating of the arterial bleeding. The stopping and controlling the bleeding is called hemostasis, which is the necessary part of both surgery and first medical aid. There are two groups of stopping, the two groups of methods for stopping bleeding, temporary and final. Temporary methods of stopping bleeding are referred to methods of first aid, and with the help of these methods, you can stop the bleeding for approximately 3 hours. And this will allow you to deliver the victim to qualified medical aid is provided. Depending on the type of injury and characteristics of the patient's conditions, the temporary methods for stopping bleeding can be used. Put a pressure bandage on the wound, close the cut with a sterile wipe and press firmly. Press the artery with your fingers. Bend the arm or leg at the joints to the maximum and apply a hemostatic tourniquet.